A joint is an articulation between bones. Synovial joints, the most common type of joint, show a wide range of form that determines range of movement. Synovial joints, such as the elbow, are relatively simple and permit movement in a single plane. Others, such as the shoulder joint, allow for complex movements in multiple planes. There are 6 types of synovial joints, each distinguished by the shape of the articular surfaces and planes of movement. In descending order of mobility, they are ball and socket joints, such as the glenohumeral joint of the shoulder, condyloid or ellipsoid joints, such as the metacarpophalangeal joints, saddle joints, such as the trapeziometacarpal joint of the thumb, plane or gliding joints, such as the intercarpal joints, hinge joints, such as the humeral ulnar joint of the elbow, and pivot joints, such as the radial ulnar joint of the elbow. A typical synovial joint is characterized by a joint or articular capsule, lined by a synovial membrane, a joint cavity, and articular cartilage covering the contact surfaces of the bones involved. The joint capsule is a connective tissue cuff that encloses the joint cavity. The joint capsule has 2 layers. A thick outer fibrous layer attaches to the articulating bones. Frequently, accessory or collateral ligaments and tendons reinforce the fibrous layer. The delicate inner layer of the joint capsule is the synovial membrane. It produces and absorbs synovial fluid, a viscous substance that lubricates and nourishes the articular surfaces. A layer of hyaline cartilage, known as articular cartilage, covers the surfaces of adjoining bones. The combination of synovial fluid and smooth articular cartilage provides a low-resistance surface for joint movement. Some synovial joints have fibrocartilaginous specializations. An example is the meniscus of the knee joint, which deepens the articular surfaces to increase joint stability and efficiency. It also acts as a shock absorber. Joint specializations such as bursae reduce friction between structures that cross a joint. For example, bursae in the shoulder lie between the joint capsule and several associated tendons. Intervertebral joints are formed by articulations between vertebral bodies, united by an intervertebral disc, and between adjacent superior and inferior articular processes. Flexion of intervertebral joints occurs when bending the trunk forward, for example, to pick up something from the ground. Extension of intervertebral joints occurs when straightening the trunk, for example, after picking up something on the ground. Lateral flexion of intervertebral joints results in lateral or sideways bending of the trunk and/or neck, for example, when leaning sideways to grasp the handle of a suitcase. Rotation of intervertebral joints occurs as the trunk and/or neck turns to one side or the other. Intervertebral joints are formed by articulations between vertebral bodies, united by an intervertebral disc, and between adjacent superior and inferior articular processes. Flexion of cervical vertebrae occurs when one bows the head or looks downward. Extension of cervical vertebrae occurs when one returns the bowed head to anatomical position. Hyperextension of cervical vertebrae occurs when one looks upward from anatomical position. Forceful hyperextension or whiplash may occur in a rear-end car crash. Lateral flexion of cervical vertebrae results in lateral or sideways bending of the trunk and/or neck, for example, as occurs during typical stretching exercises. The glenohumeral joint is the articulation between the glenoid fossa of the scapula and the head of the humerus. Flexion of the glenohumeral joint occurs when the upper limb moves anteriorly, for example, swinging the arm when walking. Extension of the glenohumeral joint occurs when the upper limb moves posteriorly, for example, swinging the arm when walking. Abduction of the glenohumeral joint moves the upper limb away from the body in the coronal plane, for example, during jumping jacks. Adduction of the glenohumeral joint moves the upper limb toward the body in the coronal plane, for example, during jumping jacks. Medial rotation of the glenohumeral joint turns the anterior aspect of the arm toward the body midline. Lateral rotation of the glenohumeral joint turns the anterior aspect of the arm away from the body midline. Circumduction of the glenohumeral joint moves the upper limb in a circular pattern, for example, when swimming the backstroke. The elbow joint is formed by the articulations between the trochlear notch of the ulna and the trochlea of the humerus, and the head of the radius, and the capitulum of the humerus. Flexion of the elbow joint bends the elbow, for example, during weightlifting or bringing a cup to the mouth. Extension of the elbow joint straightens the elbow, for example, when reaching for an object with the upper limb. The hip joint is the articulation between the head of the femur and the acetabulum of the hip bone. Flexion of the hip joint moves the lower limb anteriorly or forward, for example, when walking. Extension of the hip joint moves the lower limb posteriorly or backward, for example, when walking. Abduction of the hip joint moves the lower limb away from the body in the coronal plane, for example, during jumping jacks. Adduction of the hip joint moves the lower limb toward the body in the coronal plane, for example, during jumping jacks. Circumduction of the hip joint moves the lower limb in a circular pattern. Medial rotation of the hip joint turns the anterior aspect of the thigh toward the body midline. Lateral rotation of the hip joint turns the anterior aspect of the thigh away from the body midline. The knee joint is the articulation between the condyles of the femur and tibia and between the femur and the patella. The fibula does not participate in this joint. Flexion of the knee joint bends the knee, for example, when squatting or kicking. Extension of the knee joint straightens the knee, for example, when kicking. The radiocarpal joint, or wrist, is the articulation between the distal end of the radius and the proximal row of carpal bones. Flexion of the radiocarpal joint bends the wrist anteriorly, for example, when curling a hand weight. Extension of the radiocarpal joint bends the wrist posteriorly, for example, knocking on a door. Abduction of the radiocarpal joint moves the hand toward the radial or thumb side. Adduction of the radiocarpal joint moves the hand toward the ulnar or little finger side. The radio-ulnar joint is formed by the proximal and distal articulations of the radius with the ulna. From the anatomical position, pronation rotates the forearm so that the palm faces posteriorly. From the pronated position, supination rotates the forearm so that the palm faces anteriorly. From the supinated position, with the elbow flexed, pronation rotates the forearm so that the palm faces downward. From the pronated position with the elbow flexed, supination rotates the forearm so that the palm faces upward. The tibio-fibulo-talar joint, or ankle, is the articulation between the distal ends of the tibia and fibula and the talus. Dorsiflexion elevates the dorsum, or top surface of the foot, with respect to the ankle joint, for example, when standing on one's heels. Plantar flexion depresses the dorsum, or top surface of the foot, with respect to the ankle joint, for example, when standing on tiptoe.